So thanks very much, Kylie, for having me here, and I must offer my apology for Martin Bowles, Secretary of the Department, who had hoped to be here to do this address but wasn't able to. So it was my pleasure to be able to take that role up for him and to be back here with colleagues at the Australian College of Nursing. Before I go any further, I would like to pay my respects to the traditional owners of this land and recognise their long and ongoing connection to this land to this day. I'd also like to pay my respects and acknowledge any Aboriginal or Torres Strait Islander people that are in the audience today. Well, you've had a great few days and lots of buzz, lots of excitement. And the conference theme, as you all know, has been about making change happen. So, oh good. I'm going to see how good I go with the technology. Oh, look at that, it worked. Now, those of you that are very old will know that this is Cherry Ames. One of the things I thought I'd just very briefly explain to you or give you a bit of a background is where my role sits in the department, which has had a small change this week. And in that change, what has also been agreed is that in taking on the FAS duties, I've had agreement at the department that we formally establish an Office of the Chief Nursing and Midwifery Officer, so that will have its own staff and be the chief, my Chief Nursing and Midwifery Officer work, and then there'll be the FAS work. I suspect, though, I'm going to have to move buildings, but anyway, I'll find that out when I get back to the office. I was appointed to this role, or to the Chief Nurse role, in August 2015. And it has, as the Chief Nurse and Midwifery Officer role is really an advisory and strategic policy role. As some of you may or may not know, the Commonwealth actually doesn't deliver any services. That all gets done pretty much by the states and other parts of the health system. So it is very much a policy department. It is very much about delivering on the government of the day's agenda. So my advice is to try and facilitate, influence and provide advice on how nursing and midwifery can contribute to those various agendas. And also to bring forward at times when I can the views of the nursing and midwifery professions on what some of those agendas might be. That's certainly what I want to see happen in my role. I want to try and facilitate the opportunities for nurses and midwives to be involved in policy development. Some of the ways that I try to do that is obviously coming to things like this and hearing what's happening in the world. But also I have a nursing and midwifery strategic reference group where I have a number of the key organisations and senior nurses from all sectors come once a quarter, where we engage in hearing from one or two or three, depending on the topics, key policy issues that the Commonwealth Government is looking at this time, and providing them an opportunity to discuss and debate those and provide input into the further development of that. We also have the National Nursing and Midwifery Education Advisory Network, of which I'm a member, which brings together service sector and education to look at how the workforce is prepared and how we can address some of the workforce issues going forward. Since I've been in the role, I've actually, when I first started, people said, "We can't find you on the website." And I said, "No, that's because I don't have any page or whatever." I now have a web page. We can't fit much on it because I'm only allowed to have one page. And on that we do provide links to the office, and also we now produce a monthly newsletter where we're just trying to get out to people what some of the issues and things are that are being looked at. I don't know how many of you have ever tried to find anything on the Commonwealth Government Health website. I find it almost impenetrable. So trying to provide opportunities and links so that people don't have to spend ages looking for it. And of course we have three ministers, Minister Hunt, Minister White and Minister Gillespie. So within that, and one of the things Ashton mentioned this morning was knowing about your context, and at a Commonwealth level it's very important to know about context and for organisations like ACN so that you can influence policy. Then there is a lot of change happening in health, not unusual. From a Commonwealth's perspective, the healthcare homes, I would have to say, is potentially one of the biggest changes we've ever seen in the health system for many, many years. Healthcare homes, which will be rolled out initially with 200 trial sites to see what needs to be tweaked and changed, involves some of the most complex and sickest people in our community, It will be GP-led at this point, although there is the opportunity down the track to look at nurse practitioners being the lead clinician. And it will bundle the current set of MBS payments, a number of them, so that there's a bundled payment, which, if you think about that and if you know anything about MBS, is quite a significant shift. So that is going to be watched very closely and is something that I think we need to keep an eye on, and we need to be thinking about how can nurses play in this space. Primary health networks, many of you have come across. There's the MBS review, there's changes in mental health care, there's changes in aged care, which I'm no doubt going to become far more involved in. The review of pharmacy remuneration and regulation, and I'm sure Tim Kelsey mentioned to the Nurse Exec Group yesterday about My Health Record and some of the plans that the Digital Health Agency has. The other thing I think that, as we know, within the big picture world, the context within which we live, there is a lot of other factors that are impacting on health. Probably one of the biggest challenges of our time is antimicrobial resistance. And as nurses, we really need to be thinking about how we can contribute in that space. I mean, you know, most of us in this room have never lived in a time when there were no antibiotics. And to think that we are now starting to move into an era where we are seeing the failure of some of these to do the things we are so used to them doing and that we expect them to do, you know, we really need to understand what that potentially means for healthcare into the future. And I think nurses really have some opportunities to play key roles, not just with each other and within their health services, but with the community. You engage with people each and every day, and you can be messaging some of the things that they need to understand better. That, you know, every time I get a cold, I don't need an antibiotic, because after all, it's not going to do anything. And these sorts of things, so that there's a lot of stuff on the World Health site. We've provided some links in our newsletter, and at the next NMSRG, I'll be talking further with that group about how we better engage and leverage the potential that sits within the nursing profession to help the whole of the world address this really critical issue. Of course, you'd all be aware of the issues of workforce, technology, financing is always a constant issue, the impact from chronic and complex diseases and our ageing population, the impact of climate change on health and what that means. I mean, in our South Pacific colleagues, and in this role, I get to do quite a bit of international work. You know, some of our South Pacific colleagues, their countries are already disappearing. And we're going to see displaced people, but also shifts in some of the diseases due to climate change. Access to services and the shifts in supply and demand for services across the country. So in terms of, I thought I'd just chat briefly about a couple of key pieces of work that we've tried to lead in conjunction with the chief nurses from each of the jurisdictions, and also with the engagement of the Nursing and Midwifery Board of Australia. In March 2017, the chief nurses and the NMBA working together, I hosted a forum, or a two-day symposium. One day was on advanced practice, and the other day was on RN/RM prescribing. The objectives of these was really, one, in the advanced practice, was to get some clarity around the concept of advanced practice in the Australian context and explore the need to expand, or what we needed to do around RM prescribing, particularly for those jurisdictions that have the ripen standard, which goes in 2018, and is there an opportunity here to look at how we can better improve healthcare through RN/RM prescribing. We also, one of the things in terms of advanced practice is that the work, and I expect Glenn referred to it in her oration the other night, but the work that Gardner and Duffield had done around advanced practice, which provides us with some really good and useful Australian research for us to better understand that as a profession. So in terms of the advanced practice one, I think some of the key things that came out of the symposium was that this is a level of practice. It is not about the acquisition of technical skills. That may well form a part of reaching advanced practice, but it is not the measure of advanced practice. And that in actual fact, as identified in the research, there are 5 domains, and you need to be at a high level in all 5 domains in order to be considered advanced practice. What was also discussed and recognised was that some roles encompass different aspects of advanced practice. So there may be some people who have very strong clinical expertise and maybe some education. They're very strong in two domains, but not in the others. And so they may well be a technical specialist or an education specialist or something like that. There was also some discussion around what sort of educational requirements should or shouldn't underpin advanced practice. And certainly there was a general view that there needs to be some form of postgraduate level of education, probably a grad cert, grad dip type level, master's level. So, you know, not all these things are clear cut. I think probably it would be fair to say that it came down fairly strongly that master's level preparation represents when you're really getting up there for advanced practice. One of the things is that since we've had these 2 days, the chief nurses have attended a Nursing and Midwifery Board of Australia board meeting, and out of that board meeting, the board have agreed to review their advanced practice definition. One of the things we did say to them is, could we just have one definition, please, not two? Because there is certainly feedback on the day that having the two aspects of a definition was creating confusion within the workplace. There were a number of suggested definitions on the day. No one came out absolutely clear, and some creative people wrote their own. So there's a range of things for the board to look at and consider there. So we look forward to hearing more about that. And work is progressing at the jurisdictional level in various degrees following on from this. The other day was the prescribing, and we had 2 presentations on that day from Lisa Nissen, who's the Professor and Head of School of Clinical Sciences at the Queensland University of Technology. Lisa is a pharmacist by background and has had an extensive engagement in the development of the health professionals prescribing pathway work done by the Health Workforce Australia when it existed. One of the things that we really concentrated on this day was how do we enhance the access for the community to medicines, and what role could nursing and or midwifery play in that. And things came out about, you know, that this could improve the patient experience, that this could be a more efficient and cost-effective way, that it would enhance workforce flexibility and could feed into things such as hospital avoidance if it was implemented in an appropriate way. The outcomes from this will inform the regulatory framework to support registered nurse midwife prescribing models, provides some guidance to employers and guidance to nursing and midwifery professions. There are 2 outcome reports now which the chief nurses and the attendees at the forums all have, and which, you know, if you want it, just email my office or contact your local chief nurse, but it can be made freely available. Following the meeting with the Nursing and Midwifery Board of Australia, the chief nurses and the board have now formed a working group to progress a framework and to have something, whatever, and it'll obviously have to go out for broad public consultation and consultation with the profession and all those things, but to hopefully have something up ready to be running in October 18 when the ripened standard becomes, ceases to exist basically. And I think that this provides some real opportunities to look at some different models and ways that nurses and midwives can enhance healthcare. So how do we move from those sorts of situations to get policy and to make that sort of change happen through the policy arena? I just think there's a few things we need to remember, and some of these I heard in Ashton's talk this morning, in slightly different terms, but pretty much similar sort of approach. You need to connect with the political and social agenda of the day. If you're not connecting with the existing agendas, then you probably haven't got a lot of chance of getting your policy initiative up. You need to be able to recognise the differing needs that a certain policy might have for both individuals and for organisations. So you need to be able to think from those 2 different perspectives. You need to support some continued engagement so that you keep people involved with you. You look at how you're going to take them on that journey with you to getting a policy into action. And you need to identify the benefits and the operational attributes of a policy. There's no point writing a policy where you haven't thought about how this might look once it's operationalised. After all, many a policy has fallen by the roadside because it was completely impractical when it came to being put into practice. So thinking about those things ahead of time so that you can structure your policy in such a way that it is going to make it easier for implementation. And lastly, think about the fact that the health system is not the same everywhere. So you need to be able to build in a capacity for some level of local adaptation. Because, you know, what works in a major teaching hospital may look different at a regional hospital, may look different in an MPS, and may look different in a private hospital or somewhere else. So you need to think about how those things will look, and is there potential for a level of local adaptation without losing the key policy themes. Change is often slow and it can be frustrating, and policy work can be a very long game. Sometimes you need to be prepared for that long game. One of the things I'd like to share with you now is what I refer to as the cliche guide to policy and politics. And I do this with apologies to author Diana Mason, who wrote the Political Handbook for Nurses, from which much of this comes. And if you haven't got a copy, you should get a copy. So, okay, first of all, you need to look at the big picture, and that's about your context. What is the big picture beyond your little part of the world? Because if you're just focused in on your part of the world, you're not being aware of all the other things that are going to impact on what you are trying to do. So understand that big picture. You need to do your homework. You really need to know what you're talking about. You need to be able to be confident and really know your subject matter, whatever it is you're doing. And that's one of these things when I hear nurses talk about it's really important to have a seat at the table. Yes, it is important to have a seat at the table, but if you are an uninformed seat at the table, you are doing us more harm than good. You are better not being there. So if you're going to have a seat at the table, make sure you know what you're talking about and that you can make a contribution. Nothing ventured, nothing gained. If you don't at least have a go, you've got no chance. So, you know, while you can do as much work as you can, but you need at times to be prepared to take a little risk, stick your neck out a bit and have a go, because if you don't try, you'll never get anywhere. And I think we heard some of that in the talks early this morning in terms of being an entrepreneur and moving into business and the steep learning curves that people like Susie talked about. You know, but if they'd never ventured, they would never have got the gains that they're getting now. Sometimes it's about getting a toe in the door. It's very difficult to get anywhere if you're constantly standing outside a shut door. So sometimes you need to think about, okay, I can't get in there with the whole policy. How can I at least get my toe in the door that'll then allow me to start to develop that policy to its fullest extent, as I may wish? And identify who your friends and allies are. Who are those that are going to come along and support you and help you get this policy to where you want to get it and make it happen? And how can you, in return, support them perhaps in something that they wish to achieve and in some policy initiative that they may be interested in prosecuting? Walk a mile in another's shoes. When you're presenting policies, and I heard this morning, I think it was in Patricia Davidson's short clip, it's no point talking about nurses. It's not that there's no point, but it shouldn't be the only point. But if you cannot understand where the other person who you're pitching to is positioned, you are going to find it harder to convince them of your argument if you speak in our language. We all have a language, which we're often unaware of, that we all know and understand instantly when we talk to each other. But you go and talk to a financial person or a politician or a CEO of some other part who's not a nurse, and you speak in the way we see things, they're just going to sit there and go, yeah, so. So you need to understand what their world looks like, put yourself in their shoes and pitch your policy to them, to what pushes their buttons in effect, and think about what's going to be important for them. You need to strike while the iron is hot. Now, this is difficult sometimes because you might be in the midst of doing your homework and getting all your things lined up, and suddenly an opportunity presents and it's too good to miss. Windows of opportunity open. You need to be prepared to leap through them. And sometimes you may get a policy into operation not for the reasons you thought you were going to get it in for, but because some other opportunity arose and you could put forward this policy as one of the solutions. So things don't always happen the way we expect them to. One of the things I would argue in roles like mine is you have to be a pragmatist. It's great to have ideals, but if you are purely idealistic, you're probably destined to be disappointed, and you need to not let go of your ideals, but be prepared to take opportunities and move when things enable you to. You need to read between the lines. There are a lot of things that are unsaid. There are a lot of conversations that occur that you're not part of, and you can just pick up from other conversations that there's something else going on here. I need to think about that, and how does that impact my policy or what I want to achieve, and how am I going to perhaps make sure I've addressed that point, even though nobody's directly said to me that that's a critical issue. And while we all want to get the whole, sometimes half a loaf is better than none. Sometimes you can't get everything you want. I would argue that when we got nurse practitioners in this country, we accepted half a loaf is better than none. It wasn't the ideal model, it wasn't exactly what we wanted. We probably could have waited another 10 or 20 years. We'd already waited 10. There was a decision pretty much made that we will go with what we can get now, and we will continue to grow and develop and work on those roles to finally get them to where we ideally might like to see them. And that leads me to the last point. Rome wasn't built in a day. As I said earlier, you need to be in things for the long game. Policy work is about a long game. You can't expect that you're going to get it all in a week. Sometimes it's months. Nurse practitioners was 10 years. We'd argue that's a bit long. But, you know, sometimes it takes that long because there's huge levers that have to be moved. But I think if you're not prepared to sit in things for the long game, then you probably may need to make a decision early not to actually get engaged as much. So I'm going to show you a short video in a minute, and I think that it exemplifies some of the key points about making change happen. So I think it will just play. So I think what we see there, you know, there's some really key points, and some of the ones that stand out for me are building that culture that supports and embraces innovation and staff, working with people and treating people with respect, among a range of other things. So I'd just like to finish this presentation, and Mahatma Gandhi's had a bit of a run today, so he's getting another run, which I think particularly highlights the potential that lies within us to all achieve the necessary to change, to influence and realise change through legislation, policy and strategic direction, but also in our day-to-day interactions with each other and in our workplaces. The difference between what we do and what we are capable of doing would suffice to solve most of the world's problems. Thank you.